Good morning. I promised you guys a medical show this week, and I'm here to deliver. So, the show today is about when science lies and also the risks that some of you are not aware of when you go for something you're told you need to do to protect your health and to prevent things like cancer and other situations, to test for acid reflux. There are risks to many of these preventive tests that you need to know about. But when science lies, and a lot of scientists will say, no, science doesn't lie, it's exact science. Well, I am a victim of science lying. You all know my story about my pap smear in 2006, 41 years old. Never had an abnormal pap smear in my life, and I get the call, your pap smear came back abnormal. You have HPV, the human papillomavirus. Your husband gave it to you. This is what I was told. You need to come in next week for a biopsy. And I started thinking, wow, I have a lot of girlfriends who have had abnormal pap smears. I never had. But when they had their abnormal pap smears, it was assumed, since it was their very first one, that it was a mistake. And they waited 4 months or 6 months and had another pap smear just to make sure. I wasn't offered that. I was told immediately, this is definite. There's something wrong with your cervix. You need a biopsy. And then based on the biopsy, which of course I didn't know, I was scared. I got the biopsy, which I should not have done, by the way. Because the biopsy actually came back science kind of lying, because the biopsy came back unknown to me, tissue insufficient for evaluation. And yet, the doctor at Planned Parenthood told me, based on my biopsy, I should have cryosurgery. Now, wait a minute. What? So I looked up cryosurgery. I'm like, no, I'm not doing that. I'm getting a second opinion. Then I ended up getting 2 second opinions. And I'm glad I did, because it turns out the original pap smear, somebody, a human being, made a mistake. Big one. First of all, they assumed I had the human papillomavirus, but they had never actually tested me for it. They assumed my husband gave it to me. Yeah, that was a fun year in our house, thinking my husband might have given me cervical cancer. Really? He wasn't feeling so good either. And it all was a big mistake. There was never anything wrong with my cervix. So I promised myself, after going through that year, spending a lot of money out of pocket to prove that this lab in Kentucky, where my pap smear went, made a mistake. I had to prove that it was a mistake, or else I wouldn't have been eligible for health insurance. And once I did that, I promised myself that once I no longer needed birth control, because when you're on birth control, they won't give you your birth control unless you submit to an annual pap smear. That's how they run. That's how they work it. You want your birth control, you have to let us shove our fingers up your vagina once a year and do a pap smear. And sometimes those pap smears make mistakes. The science lies. So I promised myself that once I went through menopause and no longer needed birth control, I was never again going to be bullied into submitting to a preventative reproductive screening of any kind. And I stood by that. And here I am. I'm doing okay. I don't have any problems. Mammograms. They're another one that sometimes they make mistakes. That's why the Cancer Society has changed the guidelines. Healthy women with no history of breast cancer in their family should not get mammograms every year according to some guidelines. Now, again, this is up to you. I'm not here to tell you not to do something that you want to do. I'm not a doctor. And I don't know your family history or how you feel about this. I'm here to give you some facts. And they're interesting. The facts that, of course, it's about the money. Health insurance companies found that they were spending a lot of money doing fine needle biopsies and extra mammograms and ultrasounds for women who actually didn't require them because the mammograms were read improperly. These women were told there was a mass or there was something wrong with their breast, and there was nothing wrong with it. I'm a victim of that too, by the way. My very first mammogram. Area of concern in left breast. Scary. But luckily it only took 1 week and $35 because of my insurance at the time to prove that, oops, no, we saw a shadow, the mammogram wasn't done right, you're fine. Yeah, nice, right though? Nice, to scare you, to make you think you have cancer when you don't. But today I want to talk about some more invasive preventive tests, okay? One of them, of course, is the endoscopy, and that is the test that killed Joan Rivers, the comedian. And it's a very invasive test. If you read the small print when you sign off, they can do a lot of damage to you. They stick a tube down your throat into your esophagus. Lots of bad things can happen. And sure, you might be having an issue. Joan Rivers was having a problem with her throat. They thought she might have esophageal cancer. So, of course, she wanted to get the test done. But she died not from esophageal cancer. She died from the test. The test killed her. And I think that's something that before you get a preventive test to make you feel better, to pat yourself on the back, yeah, they said I should have this, I had it, you need to know the risks. So, now we're going to go with the big C. And the big C is not for cancer, it's for colonoscopy. Yeah. The year I turned 50, a doctor right away said to me, well, you know, you need to start thinking about, scheduling your colonoscopy. You're 50. Yeah, I said, I thought about it, and I'm thinking, no, thank you. And this is something that's really interesting, and you women out there who have husbands, you know. Men don't do doctors, men don't do physicals, men don't do preventive testing. You have to force them into it, right? All of a sudden, my husband is like, well, my parents just had their colonoscopies. Shouldn't you be getting one? And I just laughed my ass off. And the reason I laughed was because a few years back, my husband had a small health scare. It wasn't a big deal. But he was denied disability insurance for something that was really stupid. He was basically, I believe, denied disability insurance because he was overweight at the time. But he went for a complete physical. And some of his numbers came back sketchy, but nothing that needed to be treated. Nothing that was going to kill him. And he's still alive today. But he was told, if you want to not be on medication, you should drop about, 30, 40 pounds. And he did. He lost 40 pounds. But the deal was he was supposed to go back for an annual physical, get his blood taken. It's just a blood test, man. And he hasn't done that. He promised me he was going to, but he didn't. Now, all of a sudden, I'm hearing the C word a lot in my house, in my kitchen. Shouldn't you get a colonoscopy? I'm like, I'll tell you what, sweetheart. I'll make you a deal. You're 5 years younger than I am. So when I'm 55 and you're 50, if you go running out and you get a colonoscopy, I'll see how that works for you. And then I will strongly consider it. I didn't say I would do it. I said I would strongly consider it. And it's funny because I know damn well right my husband is not going to let them stick a 16-foot snake up his ass. I know he's not going to do that. Hell, he got a prostate exam. He didn't know he was getting one, but it was part of his physical, and he was pissed off about that for days. I can't believe it. I didn't want that. Right. Well, I don't want a 16-foot snake shoved up my rectum either. Okay? Here's the thing, and again, I'm not a doctor, and I don't know all of you personally. If you believe you want to get a colonoscopy and you need to get one, then get it. But know the risks, because I did some research. Yes, I did. And I kind of was thinking about maybe, because this was a colonoscopy month and Katie Couric went live on TV and had a colonoscopy on TV and everything went well. Of course it did. It's Katie Couric and it's being filmed. You think they were going to make a mistake with Katie freaking Couric? But they do make mistakes. And when they make a mistake doing your colonoscopy, bad things can happen. Okay? First of all, the prep is, depending who you research and what site you go to, some people say the prep is no big deal. Other people say, I shit my pants, I shit the bed, I shit the car on the way to the colonoscopy. Some people tell you bring a change of clothes because you're probably going to shit your pants. Some people say just go live in the bathroom for 8 hours while you're doing the prep. Take your computer in there or a book. I'm like, are you freaking kidding me? I'm going to live in my bathroom? I mean, you have to remember me. I mean, I've got to take my ashtray up there, my cigarettes. I've got to put a TV in there. I mean, I'm not going to miss my shows because I'm shitting out everything I've eaten the past 2 years. So the prep itself is not pleasant. They call it explosive diarrhea for several hours. Some people, because they have explosive diarrhea, their electrolytes go haywire. They get very lightheaded. They pass out. They get very dehydrated. Okay? So it's a very difficult prep to get this test. Now, the good news about the colonoscopy, which I like, because unlike all the other tests, you're not sitting around waiting for weeks to get the phone call with the results. The test can also be the cure. If they get up there and they find polyps, they can remove them before they turn into bad things like cancer. That's awesome. But there's something else they can do. They can get that snake up there and the person controlling the snake can do an oops. And if that person does an oops, they can put a tear into your intestine or your colon or even nick your bowel, which in some cases requires surgery to repair. And some cases requires shitting in a bag for the rest of your life. So imagine you're going in because you're going to do everything you can to protect your health, right? You're a good girl. You're 50. You're going for that colonoscopy. You're 50 years old, right? Long life to live. You don't want colon cancer. And then they come out and say, good news, Mrs. Luciano. You don't have cancer. Bad news, you're going to shit in a bag for the rest of your life. We had to do a colostomy. That's not good with me. Now, again, no offense to all of you wonderful, beautiful people out there who are strong enough, who live with a colostomy every day. Good for you. That ain't me. And I don't think it's my husband either, to be honest with you. I think when we said for sickness or in health in our marriage vows, we didn't mean changing shit bags. And I'm not trying to be snarky about this. I'm not. People who live with colostomies are the bravest people I know. But personally, I can't do it. And it's actually in my power of attorney. Pull the plug. She's not going to live like this. Okay, that's me. And it's my right to have that choice of what I will and will not live with. And the saddest thing of all is when you go in for these preventive tests, there's nothing wrong with you at that time. You're just getting that good girl, nothing wrong, good job. But then the test itself could make something wrong with you. Could turn you from someone just going in for preventive testing to be good about your health and keeping up with your health, and that would turn you into a patient with a chronic condition. And I'm not sure that's worth the risk. At least for me, at this time in my life, it's not. Okay, that's my choice. For all of you who are thinking about it or who have been told you need to do it, of course, when someone tells me I need to do something, that's usually the thing I refuse to do. I'm not the kind of girl that's told what to do easily. I don't like having to do anything, especially something that makes me uncomfortable or could possibly alter my lifestyle in any way. That's me. I just want my viewers out there, the people I care about, and I care about all of you, to know the risks before you do it. And also understand the rewards. Okay, you had your colonoscopy. You don't have colon cancer. Awesome. You had your mammogram. Beautiful. No breast cancer. You had your pap smear and your pelvic exam. No reproductive cancer. Awesome. When was the last time you had a preventive test for pancreatic cancer? Or bladder cancer? Or liver cancer? Or brain cancer? Bet you haven't. Guess why? Because there aren't any. While we pat ourselves on the back that we're going to live forever because we've quit smoking and we've lost weight and we've had all our preventive tests, we've had our skin cancer screenings, our pap smears, our mammograms, our colonoscopies, our prostate exams, we still don't know that we're cancer-free. Because there are no preventive screenings, early detection for the cancers that are actually killing more people than many of these other ones are. Sure, the preventive tests have cut back on people dying from breast cancer and cervical cancer and colon cancer. But more and more people now are dying, young people, by the way, 40s, early 50s, dying from pancreatic cancer. No preventive screening. Nothing they can do. Once you get it, you're dying. Bladder cancer is another one. I didn't even know bladder cancer was a big deal till one of my friends last year was diagnosed with it. And her life was altered because they didn't catch it in time, because there are no real symptoms. There's nothing that you go get checked for. There's kidney cancer. There's bone cancer. There's sinus cancer. All kinds of cancers there are no screenings for. So do what you want to do. You make your own choices. Don't let anybody bully you or shame you or bet you, I'll bet you you're not getting a colonoscopy. Don't let anybody do that. You do it for you. And you know the risks, you know the rewards, but understand that just because all these other tests come back cool, you're good, no cancer, doesn't mean you don't have cancer. And it also doesn't mean you're not going to get something else. A friend of mine, I had dinner with her, and she told me her brother has something called sclerosis. It's a really bad disease, and it costs a lot of money to maintain. There are a lot of diseases out there there's no preventative test for. It's not cancer, but it might as well be. It's expensive. It's chronic. It doesn't go away. There's no cure for it. MS, multiple sclerosis, ALS, Lou Gehrig's disease, Alzheimer's. There's no preventative test for any of this crap, but they're going to ruin your life and they could kill you. So while you pat yourself on the back for having all these tests and having all these doctor appointments and sitting by the phone waiting for the results, and by the way, hoping that your test results are actually accurate, because as I've just told you, science sometimes lies, and there are mistakes made when reading these test results. Some people are treated differently than other people based on if the place where you're going for the treatment wants more of your money. That's what I truly believe happened to me in 2006. I think they just wanted money because there was nothing wrong with me, yet they were willing to keep treating me for something that I didn't have, and that's kind of scary to me. It's even scarier that it was Planned Parenthood, an organization I support, because I think young, poor women need a place to go to get birth control and STD screenings and pelvic exams and pap smears. But if they're going to lie to their patients and tell them they have a disease they don't have, I have a problem with that. A big problem. And they know it. I made that very clear in 2006 and 2007 when I realize that they did screw me over huge. So understand that. Understand that before you take a risk, because every procedure has its risks. Mammograms and pap smears, not so much. But when you're talking the stuff where they shove stuff down your throat or stuff up your butt, there's always a risk. There's always a risk. You have to do your homework. And then you, for yourself, have to decide risk versus reward, and what you're willing to risk to get that temporary, very temporary reward. Because you might not have colon cancer today, but you could have pancreatic cancer tomorrow. That's what I got. Can't wait to see your comments. And I would like to hear from anybody who has been misdiagnosed with a serious illness and how that worked out for you and how you found out about it and what you did. So please, send me your comments. I'm always here to listen. Have a great weekend, everybody. This is my last show for the week. I'll see you back here on Tuesday. Political Paula is out.